Hello, my name is Brian Gallagher, and I'm one of the many board-certified physicians here at the Urology Center of Iowa. So Rezūm is a treatment for the prostate which uses water vaporization to denature the protein in the prostate tissue itself, and then that tissue then later necroses or dies off. Whereas UroLift is a procedure, again in the office, where we kind of tack back the lateral lobes of the prostate to try to open it up and allow the patients to urinate a little bit more freely. So we have a benign prostatic hypertrophy pathway here at Urology Center of Iowa that all patients are started and they go through the process so they get a full workup with regards to individualized medicine. We get to determine what each individual patient needs and which procedures would be most beneficial for them. So they go through a whole process where we can do some in-office testing, including ultrasound to measure the size of the prostate. We also do some uroflow testing, basically to determine the type of pressure that they're generating when they urinate. And then we can even do a cystoscopy here in the office where we'll get a better idea of the anatomy of the prostate and the bladder. And again, we kind of tie all these three things or these four things together to try to determine which procedures are best suited for each individual patient. Within the last few years, they've developed some in-office procedures for BPH patients, and we're trying to stay on the leading edge or the cutting edge with regards to technological advances in urology, and we want to be able to offer all of our patients the highest quality and most recent technology. About 60% of men who are 60 years of age, 70% of men who are 70 years of age, and 80% of men who are 80 years of age. At the age of 80, about 50% of men have severe urinary symptoms requiring intervention. Symptoms that can accompany benign prostatic hypertrophy are urinary urgency, feeling like you need to get to the bathroom, can't get there in time, frequency, going often, weakened stream, getting up at night, sometimes even blood in the urine. So when your symptoms are beginning to interfere with your day-to-day activity, that's when it's usually time to make an intervention. Treatment is initiated by their primary care physician with some medications. There's two different types of medications that we have to treat BPH. If those medications aren't successful, or if they've been on those medications for an extended period of time and their symptoms aren't improving, then oftentimes they're referred to us to delve into it a little bit further. I tell patients that we offer a whole gamut of procedures for benign prostatic hypertrophy, from smaller in-office procedures to more invasive procedures where they're put to sleep. And you can kind of expect a return on your investment, so to speak. So the shorter in-office procedures may not give you the duration of a longer procedure where we put you to sleep, but for the short term, 3 to 5 years, these patients have been documented to do really, really well. If you're looking at something a little bit longer term, then it might be a little bit more investment on the front end, where you might need a general anesthetic for an hour, still as an outpatient surgery most of the time, but you still can get, or with that investment, you get a little bit longer return, 8 to 10 years benefit with regards to treatment. If your facility has patients that are having issues with urologic difficulties, we would love to step in and assist them on the road to recovery.